Hi there, it's Dr. Chatterson here at Woodinville Animal Hospital, and today we're going to show you what our doctors do when we're doing a physical exam on your pet. So here in our rooms, we do have the non-slip surfaces on the tables for the cats and the smaller dogs so that they're more comfortable and not slipping on the surfaces. And we also have in all of our rooms our through a dog's ear and through a cat's ear music that's more calming. It's supposed to be calming for them, so we always have those playing. But today we have Penny. She's one of our office cats, and she gets to join us. So what we'll do is we'll start out, and we always look, I kind of go nose to tail, and so we start out with their face, and we look at their eyes, and make sure there's no redness or discharge. We look at her nose, again, to make sure there's no discharge or abnormalities. We'll look in both of her ears to make sure there's no redness, no increased waxy debris, or any signs of infection. And then, especially with the kitties, I try to just give them chin scratches so they think they're getting pets, but I'm actually feeling their lymph nodes, feeling their salivary glands, and then starting to work my way down her throat and make sure her thyroid feels good. Come back, Penny. I know. So then as we work our way down, I'm going to check her lymph nodes in front of her shoulders. We'll go down her spine and make sure that there's nothing that feels painful or abnormal to her. Check her muscle mass along there. And then, of course, feeling all over her skin to make sure there's no lumps or bumps or masses or anything. And if we did find something like that, then we can check it out while she's right here with us, and we have a lab here in-house where we can check those. So we'll check those and give you tail scratches. And so now I'm gonna feel her abdomen, and I'm feeling up high to check her kidneys. And then we go down lower and feel right along her ribs to make sure her liver feels fine. And then back through her intestines. And then you can actually feel if they have a urinary bladder and make sure that's not uncomfortable to her. And then I check the insides of her legs where their femoral pulses are, and that's a great place to check pulses for these small animals. And here's your normal. And then lastly, I'll check her popliteal lymph nodes behind her knees. That all feels good. And then the other thing that we can check on them, I know, is checking their joints. So we extend their legs out and feel all those joints and make sure there's no pain and there's no snaps or crackles or signs of arthritis starting. Penny's still pretty young, so hers feel good. And kitties aren't big fans of orthopedic exams. But you're doing good, Penny. I know. Yeah. Stretch your legs back. Yeah. And those look good. So then lastly, of course, I need to listen to her heart and her lungs and make sure that there's no heart murmurs, that she's got a normal rhythm, and that her lungs sound nice and clear. So listen. And Penny sounds great. Penny gets a good checkup today. So hopefully now you can all see what we're doing while we're in here during COVID, but of course when you'll be in here with your pets again, then you'll see what we'll be doing with your pet. Thank you so much.
Yay, Penny!